Hi, Lisa Broyles with Way 2 Health MD, and this video is about NOS3. This is Nitric Oxide Synthase 3 in my genetic series. This gene is critical if you have high blood pressure, you're starting to have cognitive issues, you're a diabetic, maybe you've been diagnosed with Parkinson's, Alzheimer's, cardiovascular disease. This is extremely important. So the NOS3 gene makes nitric oxide. Nitric oxide dilates our blood vessels. When our blood vessels are dilated, they can bring oxygen to the tissues that we need it to. So the muscles, so that muscles don't cramp, the heart so that it beats properly and regularly, the brain so that we can think clearly. So you have to have nitric oxide production. It's critical. That's why people that have heart disease are often given nitroglycerin to force those blood vessels to dilate, to open. It's also used to treat erectile dysfunction because, again, the penis needs enough oxygen and enough blood flow to fill the tissues and be firm. You need nitric oxide production for cardiovascular disease, to treat it for your blood pressure regulation, for thinking clearly, for blood sugar regulation, and for healthy erections. So what makes this gene go awry, or this enzyme? So any condition that decreases your oxygen is going to damage the NOS3. So if you have chronic sinus congestion, if you have sleep apnea that's untreated, if you have a sedentary lifestyle and you're not exercising, you are not getting enough oxygen to these tissues. Not enough oxygen, you can't make enough of the NOS3, okay? And then you don't have enough nitric oxide and it makes all of it worse. That's why it's so important when you're starting to have high blood pressure, you need to exercise, and exercise will actually improve your blood pressure, not just because you're losing weight, but because you're making more nitric oxide, which is going to bring more oxygen to your tissues. There also are several dietary ingredients that are key to a healthy NOS3 gene. These are arginine and something called BH4. Please do not go out and buy a supplement of arginine and BH4 because this doesn't work. Researchers have tried it and it often can make conditions worse, because if you have an NOS3 gene enzyme that's not working well and then you take a supplement of just arginine or just BH4, you can make that enzyme not work correctly, and then it starts making something called superoxide, which is a free radical that damages the blood vessels more. Not what you want to do. So you need to help your body make more BH4 on its own. So zinc, magnesium, and folate all help your body make its own BH4. You also have to avoid industrial pollutants, toxins. We talked about xenobiotics with the GST and GPX enzymes. Also, women that have gone through menopause and lose that estrogen, they're going to make less nitric oxide. So hormone therapy helps with a healthy NOS3, keeping your diet clean and organic, detoxing as much as possible. A healthy gut microbiome also, if there are inflammatory bacteria in your gut, they actually decrease nitric oxide production and production of BH4. BH4 is extremely sensitive to pollutants and toxins. So if you are someone that has some of those other genes that I've been talking about that aren't working right, the MTHFR, the PEMT, which is actually coming next, GPX, any of those that are dirty are going to decrease the body's ability to make nitric oxide. So cleaning up the system is going to help it. You need to get up and exercise. You need to avoid synthetic folic acid, which is in a lot of foods, cereals, drinks. Synthetic folic acid actually makes your NOS3 not able to produce enough nitric oxide. You need methylated folate, which is in multiple vitamins and supplements. So if you have a supplement that has arginine in it, and you are exercising, eating cleanly, trying to keep your body less inflamed, working on those stress levels, treating your sleep apnea, cleaning up that sinus congestion, then your NOS3 gene is going to work properly. There's also certain foods that are going to improve production of arginine, and this is meats, turkey, chicken, pork, chickpeas, spinach, lentils, spirulina. So there are some good dietary sources of arginine, but ideally you want your body to make it on its own. Thank you very much.